All right, we are at 6 o'clock and we're going to go ahead and get started here. Hopefully, those that who have not joined us will be able to tag in soon. We'll get through the introductions and get our presentation started. Good evening, and welcome to the Florida Academy of Family Physicians webinar, Medical Loan Repayment Frame Update. I'm Jay Milson, the Executive Vice President of the FAFP. It's my pleasure to moderate tonight's session and introduce our presenter, Mr. Jeff Johnson, who is the Primary Care Office Director at the Florida Department of Health. One of Jeff's primary responsibilities is to oversee the Florida Reimbursement Assistance for Medical Education Program, FRAME, which promotes the practice of qualified medical professionals in underserved areas of the state through medical loan repayment. With the next application cycle opening on February 1st through March 31st, 2025, we're grateful for Jeff and Alan Gertz from his team for providing an overview of the FRAME program, updates to the application for this year, which are really important, and to answer FAFP members' questions to help simplify the process. Now, before we get started, please note all participants, all the members that are participating, you're in listen-only mode. If you have a question, simply type it in the Q&A section. And Jeff will attempt to, he'll probably wait until after his presentation to answer the questions, but we've got plenty of time. We've got the whole hour allotted, and I don't think he's indicated that it's certainly not going to take anywhere near that amount of time for him to go through his information, and we'll get your questions answered. If any questions surface after the meeting, we'll post at the end email addresses so that you can reach out to us and get the answers to those questions to make sure that we can avoid any hassles and any problems with the application process. So, Jeff, Alan, we really appreciate you being here tonight. You take it away.
Well, thank you so much, Jay. We really appreciate you and your team hosting us this evening. These opportunities are just so incredibly valuable, not only for us as a team, but we want to make it equally as valuable for your membership as well. This particular year of the FRAME program, this being our third year, we haven't had two of the same years yet. And so each year the legislature's done something a little different or added a program. And in the case of this year, they've done several things for the FRAME program. What I wanted to make sure that you all could see is sharing with you the Frameworks portal. And the balance of the information that we're going to share with you this evening is published here on the portal. We actually have a downloadable brochure that's available from the portal as well. One thing that I will make you aware of as we begin our conversation this evening is that our Florida administrative rule process is still underway through the department. So there are certain topics that we're going to keep very close to statute because until we complete that rules process, a lot of the hows of the process and the application cycle will still be available for public review and comment and those kinds of things. So if we seem a little circumspect about a topic, we're being deliberate in doing so just so we don't compromise the rules process. But we think we've got lots of good information to share with you all this evening. In beginning, kind of giving you a quick overview, again, this is the Frameworks portal, and I'm actually going to jump right to the brochure so that if after the our conversation or conference this evening, if you want to go and find that information or you forget a bit of it that we shared earlier, if you visit this program information drop down in the upper left, and if you look at the FRAME brochure, we have actually posted the brochure available to you there. And at the very bottom of the page, you'll see that it's also downloadable. So welcome you to print that out, share it with your colleagues, review it for any questions that you may have. But what we'll primarily do this evening are talk about some major changes to the program. The Senate Bill 7016, the Live Healthy Bill that was promoted through the Senate, does a number of things across a variety of the programs that our department, as well as others, administers. Specific to the FRAME program, it does a couple really notable things. In the past, Our initial funding during the first cycle of the program began at $6 million. Before we ended the first cycle, they had appropriated another $10 million for that program. And then that $16 million carried forward into last year. Last year also featured an appropriation for the frame dental program, and it went from it was actually initially appropriated at 1.8 million. In terms of scale, the program has received an additional $30 million in funding. So the frame program is now at $46 million. And then we have our partner program, frame dental program, and it received an additional $8 million. So, we're looking at a significant increase in funding. And what we hope and what we believe that's going to mean is a significant increase in the number of awards. Now, we say that with just a little bit of salt, because one of the other interesting things that the legislation does is it changes the award ceilings and award totals for the program. Now, for your audience, we've also included that here. You can see what the new award ceilings are. So for our MDs and DOs, the maximum total award over 4 years, which is another new aspect of the program, is $150,000. So it's a significant investment. And one of the things that this $150,000 represents is a 4-year award. But one of the other aspects of the new legislation is that the award ceiling is actually, if you'll see right up there at the top, is limited to 25% of the principal loan balance. So it's quite possible that a physician with a very high loan balance could be in and out in 1 year once they hit that maximum $150,000 threshold. So a lot more dollars, but as we approach the funding aspect of going through the award designation process, we don't know how many new awards they'll have. So beyond just awards, one of the other things that it does is it changes the eligibility for specific types. It includes dental hygienists this year, as well as psychologists. And you'll see there's actually a host of mental health folks that have been added to the frame program. And we talked about the new maximum award amounts based on practitioner types. The new program limitations, so we know it's a 4-year program, or maximum of 4 awards. Now, in the event that a participant comes in 1 year, leaves 1 year, comes back again, it's actually 4 total awards. They don't have to be consecutive years. They can be years in between. However, we are through rule contemplating what that exit and return prioritization looks like, specifically because our intent is really to have sequential years of service. It helps, really provide that community with an ongoing source of access to care, which it may not have otherwise. Other new aspects of the program this year, including expanding eligibility for autonomous practice APRNs. Previously, they had to have been in a HPSA. And if everybody remembers what a HPSA is, it's a health professional shortage area. These are areas across the state that are designated in concert with HRSA as featuring or having 5 different specific components that contribute to an overall HPSA score. HPSA scores can range for primary care from 0 to 25. So the higher number for health professional shortage area or HPSA, the greater the need in those communities, and we factor that into our prioritization score. And then beyond that, you'll see the expanded practice for dental service. And then one of the most important aspects and changes in the program for both frame and frame dental is that the legislature is now requiring 25 hours of volunteer service annually. So what we have been working with is the timeframes and trying to create an environment here in the Frameworks portal that serves as kind of a starting place for folks who are interested in the program to identify those volunteer opportunities around the state. It's just a very beginning inventory, or we call it the searchable index. You can search it by counties. I'll have Alan talk a little bit and show a little bit about that index in a minute. And then, but one of the, as we look forward in the future, because of the kind of abbreviated timeline between the initial uh, legislation being signed by the governor and our implementation, we have a year within which those hours or those volunteer service hours have to be provided. So for this particular year, you can anticipate that we'll probably ask for how many hours you have to date at the time of your application, and then actually create an attestation that will, beyond that period, say that yes, I know I'm accepting, or I'm applying my award, and I know I have 12 hours left of volunteer service. Volunteer service is probably one of the more challenging aspects for this year for any number of reasons, not the least of which is, the prevalence of the natural disasters that we've had, but just the hours in the day that it's necessary. But the other side of that is when you look at it, the program itself, and you look at a $150,000 award or potential award, that's $6,000 an hour. So we're hoping that the requirement itself is not seen as a burden, because we certainly don't. We see it as a great opportunity to actually increase the amount of access in underserved communities across the state. So I'm going to take a pause there, and Alan, do you want to share, or do you want me to go down through that search portal?
I mean, I can pipe in and pull it up.
Okay.
I was pulling up the actual statute here for another reason.
Okay. So I'm going to pop open this volunteer opportunities, and Alan, if you want to lead, I'll navigate.
I mean, it might be easier for me to do it. That way I'm
Okay.
driving the whole time. Yeah.
I'm going to stop sharing, and Alan, you can share.
Yeah. I think, yeah, it'll be easier. So basically, from my end as a program manager, a lot of the questions that I've been receiving frequently through our cases is questions of thinking that everything that you're seeing here is the only acceptable locations for volunteerism. If you read into the language that we have above, us as Frame, we're trying to do our part to assist with finding potential volunteer opportunities. I mean, to be quite frank, we are literally Googling, trying to find organizations out there that offer volunteerism, and we're putting them on our site. It's been a misconception that people are thinking that everything that you see is just the authorized locations. That is not the case. We're currently actually are in the process of bringing on 7 additional employees that will head up this initiative to find specific volunteer locations, to find special events that are coming up, and they need 5 nurses, they need 6 APRNs, whatever it might be. So we're doing our best to try and at least kind of give you an idea. If you're in, Jefferson County and you don't know where to go, we're trying to find at least local areas that you might be able to contact. The thing is with volunteerism from the provider side of things, it's not Habitat for Humanity. You can't just show up with a hammer and say, what board do I nail in? You're still going to have to reach out to the organization. You're going to have to fill out their forms. You're going to have to get registered, and they might have a license check. So here at Frame, we're not trying to be the party planners. We're just going to do our best to try and find out and network with these individual organizations to find places that might potentially have volunteer opportunities. And so the majority of my cases that I see are I want to go volunteer. I'm in this county. My location isn't on the list. Like, is it eligible? That's not the case. We're going to do our best to continue as like a living document to identify locations that might have potential volunteer opportunities. So, when you come through our portal, you can select a couple of different things. You can, select the services provided and navigate through that. You can go through the different counties so you can find your exact county and do searches. And this is, like I said, it's going to be a living document. We're going to do our best to try and, network with these community, clinics, and in the future, try and find out about what they have coming up for the special events, because I know that's going to be a huge deal for a lot of people to kind of navigate and get in their hours. But I just want to be straightforward.
Yeah.
This list is not exhaustive. We are trying our best to add organizations. And as you can see right
Yeah.
here, we already have a link for organizations that want to be a part of Frame. They can go in there, they can fill out their, details on an event that's coming up. But we're just trying to do our best to try and help guide practitioners to a potential volunteer opportunity.
Yeah,
I mean,
that's great. If I could really quick, I appreciate you bringing that up, that they can submit to you if they
yeah,
have something out there, whether it's the organization or them or the physicians themselves submit that information to you.
yeah.
How would sports physicals play into that? That's a good question. It came up, and a lot of our docs participate in sports physicals. Would that be through the health department or through the organization,
So
a local organization that's organizing
I'll,
it?
I'll say this. I mean, honestly, within statute, it mentions free clinics. It mentions Chapter 110 programs that are organized by the state. Okay, but when you go into the statute for free clinics, it's pretty broad. It's not like when you read it right off the cuff, you think maybe it's like a brick and mortar. It's a place that says free clinic, come
Right.
your
Yeah.
services. When you read into the
Yeah.
statute, it's a little bit more broad. So
So
our
yeah,
stance
go ahead.
is
I'm sorry.
our stance is, if you're working with an organization providing, primary care services for free, and as long as that organization is also providing services for free to the uninsured population, we're not in the business of trying to find a way to deny your volunteer hours. So as long as it's associated with primary care, then
Yeah.
we're going to be okay with that. I've gotten a lot of questions, especially from the nurse community, and they're like, "Hey, if I run the medical tent at a local high school football game, if I'm in there and if somebody gets hurt, if I'm doing that, will that count?" I mean, that's primary
Yeah,
care.
so
You're
they
there.
just need to have them fill out a form and submit it to you.
Yeah,
Yeah,
I mean, and Jay, that's the real
They want to be
ultimate,
listed. Yeah, right.
because
yeah,
what we are going to review at the application time, when we have it submitted, is does the form that's been signed and countersigned. So all we're asking is the participant and the host to have that form for us so that we can account for those hours, and we're going to go into the system and make sure that those two things match for
Reasonable
us.
validation. Yep.
yeah,
Exactly.
There you
So
go.
yeah.
Yeah.
And I
Whether
mean,
it's a triathlon, a high school event, or anything, a
to
health
bring that
fair,
up, I
that type
mean,
of stuff. Yeah.
something I want to spread, and that's why this opportunity to speak to so many physicians across the board. Hopefully, they talk to their coworkers and everything that are going to be applying for Frame. You know, it's not like I've gotten a question from like gynecology, and they're like, "Hey, I'm having a hard time finding a place where gynecologists are needed." Okay, volunteerism, even if they take a gynecologist and say, "Hey, we need you to help intake. We need you to help register patients, for our free clinic or event or health fair or whatever." Anything that's contributing to the provision of primary care, we're good with it, because like I get it. There's certain specialties out there like they'd have a hard time. A pediatrician might be limited based on the scope of their profession. Um,
Right.
as long as it's primary care, we're not going to raise
Right.
too many.
and Alan makes a good point, and let me just capitalize on that as well. on our form, we're not going to be asking for the number of patients seen. We're not, all we simply want is the attestation that said, here were the hours at this location. That's our
Yeah.
litmus test.
Awesome. Okay. I think that's very helpful.
So, Alan, you want to give me back control just a second?
Oh yeah, sure. You got it, boss.
All right, thank you, sir. And so I'm glad you piped in, Jay, because I was going to take kind of a break and let you guide us on some things that your membership may want to know or we can point out. Again, we have the program information here. So aside from the changes in who is eligible and the limits and the volunteer service, those are really the three cornerstones this year.
Yeah, well, there's a question that's come up. The person that applied the last 2 years was only awarded 1 year. Does that count as 2 years of possible 4, or is it 4
Excellent
years?
question.
Yeah.
That counts as 0 years. So if if they have already received an award in either year 1 or year 2, this next cycle begins the new cycle for counting. So, it's potential that they could receive 6 awards if they've applied and received in years 1 and 2, and they joined us, applied again and received in this upcoming year, that starts the counter. So we're not going to go back and count previous awards. We're simply going to move forward in keeping with when the legislation was signed.
Yep. Right.
I would like to take the opportunity to like bring up one thing though, because there has been changes in the statute, and I want to just get the information out there. So previously, with our prior statute, there was a little bit of leeway on primary care. So in the first 2 years, we were accepting people that, and this kind of more applies to like nurses and APRNs, but we were allowing people that were working in hospitals. They're in a hospital setting, and there wasn't anything in statute that kind of specified exactly what the primary care setting was going to be. So, although we might be talking to a lot of physicians here, just understand the new statute does specify and constrain the acceptance. So, primary care physicians means an outpatient clinic, providing primary care. Other than physicians, the statute specifies, exactly what those practice locations are. So I know I'm going to get a lot of, previous nurses that worked at maybe Jackson Memorial Hospital that it might have received awards, but when they did the update to statute, we have to really focus in on the primary purpose of the program. And the purpose of the program is to award things to incentivize more primary care coming into our underserved areas. So I want to mention that just right off the cuff, because I know that's going to be kind of a concern. The only thing, if you're working in a primary care clinic as a physician that is within a hospital, then you're still good. But as we go through and evaluate things, we're trying to make sure we're not dishing out money to ER docs and people like that. The program was to try and give more access to primary care. So we're really honing in on that moving forward. I just wanted to mention that straight up.
I'm going to ask you a really tough question. I'm
Go for it.
to it, man. Here we go.
I
Is
hear it
that
all
you
the
make
time.
no guarantees with any of this, but with the amount of funding that is available in the upcoming years,
Mhm.
does it increase the opportunity? Let's say I'm a doc that got denied in the past because my scores just weren't high enough. Would you be optimistic that for reapplying, or should I be discouraged and just say I'm not going to do this again
No,
because there's no way I'm going to get it? Yeah.
absolutely
Well,
reapply.
Yeah, and for a
Absolutely
variety
reapply.
of reasons, we don't know what that applicant pool is going to look like on a year-to-year basis. And that alone would be a situation where we're going to want to anticipate growth in the program, or hang kind of the hanger that's an opportunity. So if you don't put an application in, we guarantee that we can't give you an award then. And that pool of applicants, don't forget, as we're going on year 3, Alan and I have talked about the fact that we have paid off some remaining debts. So we've got people who are already not going to be coming back to the program. And then with the scope of, our unknown right now is really thinking about what the annual caps will mean and how that will impact the number of awards. Limited to 25% of the loan balance of principal application, depending upon the debt that is being carried, that's a significant number. And we just don't know what that's going to look like in terms of award numbers. We anticipate it will increase the number of awards, but at the same point in time, we realistically understand that we're opening, or rather, the statute has opened frame to a whole new set of potential applicants as well. So that's all of our, Now, it's always helpful to know because the mental health, I'm sorry, frame exists in the two different statutes. Dental is appropriated separately and exists statutorily in a separate place. The mental health component is going to be blended into, the doctors and nurses and everyone as well. So that's going to be a significant change. But when you talk about on the order of going from 16 million to nearly $50 million, we really anticipate that we're going to see a significant growth. Last year we had 3,000 applicants and then over 1,100 awards. We might see, if we were to double those numbers in each category, that might be realistic. We really just don't know at this point. And each year it's going to depend on the applicant pool. One of the things that's stressing us is, the things that keep us up at night about where we're going to go in this first year under the new statute is, when we present an award, we've worked with the lenders, we sent the check, and we know we still have an applicant who's got 15 hours outstanding. We're going to have to be managing and communicating with them directly because until if they fail to submit, then we're in a different place with frame. And this is that first year of being in a place where we're, going to have to be actively on folks to get their hours in because, statute is also clear about us recouping those dollars through NHSC statutory requirements and everything else. So we don't want to go there. We don't like being in that place. Frame's got too many good things to do, but my point being is those folks will likely be excluded from participating in the next year. So, there's so many variables right now. We don't know exactly what it's going to look like.
Well, you mentioned doctors. So, I mean, this is, the question's been asked a bunch of times, but I think you answered it to me in the first year and it's continued. Give me a percentage because residents are eligible as well, right? Yep. So is there any way to give me an idea of how many awards were given to active practicing, clinicians versus residents?
I can speak on this because I've been in the trenches with it. So I'll be transparent and say that, year one, we were kind of learning everything as we went. And we got a lot of reported hours from residents because they were reporting on their 80-hour weeks and everything like that. So a lot of residents got money the first year. Rolling into year two, I saw a lot, like we tried to expand the direct patient care hours to like a 4-week average to try and kind of point out, the inconsistencies with that. Before prioritizing and applying awards, I made contact personally, and I'm not lying, personally with 264 individuals that had applied and had in excess of 60 hours as their direct patient care hours. And the majority of those were residents. And I required a clarification on hours because we were kind of learning in navigating the landscape of residents, and we didn't really know what was going on the first year. But I was like, I kind of knew by the second year they're reporting their inpatient, their hospital hours. We need to get it back to understanding the priority of the program that was primary care clinical hours. So I promise you, I went through all 264 of those individuals and made sure that those hours were clarified. The crazy thing was at our break point when we went out and selected for awards, a lot of those residents ended up being right there at the break point. Like some of them were above, some were below, but moving forward, I think we have a clearer path. Especially with bringing on additional individuals that are going to help me, evaluate the applications. Um, we're going to be able to look into each applicant and say, hey, okay, you're reporting that you work 40 hours. That's the norm for a, 8 to 5 or whatever, 5 days a week practice in an outpatient clinic. So when we see hours that exceed that, we're going to look into it. And we're going to make sure that the money and the awards moving forward are going to the right people because they're practicing in an outpatient primary care clinic. And that's why I bring up like
Yeah,
I'm
that's
going to get
good.
a lot of frustration from the previous applicants who have gotten awards, but you got to kind of center yourself on the purpose of the program. The purpose of the program is to deter people going to ERs, going to urgent care because they can call their PC and say, I need an appointment, I've got a rash. And
Right.
it's not a 4 month wait for an appointment.
Yeah.
That's frame.
Yeah, kind of a good segue there. Someone asked a question, a quick question is they work for Jackson Memorial Health, but they work in an outpatient clinic. So they should list the clinic, not the
Yes.
larger institution.
Yep.
Just that there's no confusion with that. Okay.
Absolutely. If you
List the
work in an
clinic.
outpatient
Okay.
clinic, put the practice location you're currently, employed at, go that way because yeah, I mean there's certain hospitals, I mean TMH here in Tallahassee, they have a primary care clinic that is co-located with the hospital. But make sure that you put your information for your outpatient clinic.
Okay. All right. All right, folks, come on. Let's roll some more questions in here. Ryan, you better have them. Let's go. We've got the experts on the line. But don't forget, if you do have questions that come up after, we can facilitate those. Here
Oh
they
yeah.
come. I love them. Is there an advantage to applying earlier in the application cycle rather than later, or does it matter?
None
Whether it's the first day of
whatsoever.
February,
It's
or
Not
the
at all.
last day
yeah.
of March?
Yeah, because you'll remember what we've been doing along with prioritizing applications, knowing that we weren't going to have enough funds to fund everyone who's going to apply. So similar in years 1 or 2, we're still going to go through the same prioritization schedule. You know, cook those numbers up, make sure that we are identifying that prioritization list, and we start from the top and until money runs out, quite literally.
Yep.
So
Okay.
is there now there is an advantage from one perspective, time, right? Because if we have that 2 month time period and you wait till the
Right.
mid-month, halfway
Right.
between the two of those, one of those forms is going to ask you to get your employer to sign off on it. And what do we know? Lots of employers are going to be signing these forms, over 3,000 applications last time. So not from a award advantage, but from being able to make sure you have all of your documentation in for your application on a timely. So that would be the advantage of starting early. We're working very hard and we're trying to get our draft forms up. You're going to see a difference in the forms from the first 2 years. We're going to be asking far less. We're trying to make sure that we're only collecting the information that is essential for us to populate the prioritization score, to look at everything. So where you're going to actually see far less. The other big change that you can anticipate is that in previous years we asked for the lender attestation. In other words, you had to sign, send off one of our forms of lenders, and we don't think that was particularly helpful, particularly when you can actually just
Appreciate
send us,
that. Yeah.
upload your statement and tell us.
Your
And
transparency and honesty is appreciated.
yeah, so I
No, we get
mean,
it. No, that's great.
so
Yeah.
we're trying to reduce the number of forms that you have to submit. You're already going to have to keep track of your volunteer hours forms, right? And we would recommend from that perspective,
Yeah.
a new form for each time you go. Another
Yes. Hey,
really
with
important
that,
reason is because you don't want to lose a form that has 30 hours on it.
Yeah.
Much better to lose a form that's got only a couple hours.
Yeah, speaking on behalf of the Florida Academy of Family Physicians, which I do every day, the physicians appreciate less documentation.
Yeah, and
you're all laughing right now. I know you are. I can hear you
I'll
through my headphones.
I'm going to chime in a little bit on that. So, in completing the frame application in the previous years, the major changes that you're going to see moving forward, and obviously we'll publish the new forms once they get through the rulemaking process and everything like that. The major time, you know, that almost time vampire that's there that takes so long is the loan. Inputting each individual loan that is going away to where when you go into our new interface, it is simply going to ask you, this is your name, this is your account number, what is your principal balance for the entirety of your loan? And that's it.
Right, right.
Because this previous year we had a lot of people that went in there and they did each individual sub loan. I've created
Yeah,
test accounts that went in and did that. It takes a while. So,
yeah, right.
moving forward, you're just simply going to say, my loans with Mohilla. Okay.
Yeah,
I have $400,000 in principal balance. That's done. And then I'm just going to submit my most recent account statement. You don't have to
right.
go to your lender. You don't have to ask them for anything. So it removes that portion.
Medicap. So yeah, on that, similar to it. So on the application start date, obviously we're talking about rules process and whatnot. But
Mhm.
by the time February 1st comes around, if the rules process is not worked out, which I expect it to be, and you do too, the application process would just move back a little bit, right? So you're not going to
Yeah,
open the process without the
that's
forms being
like last year, we
available,
ran into
right?
an issue, a little bit of a delay, and so we were able to open on the 15th of February.
Okay, all right.
Um,
Yeah.
we still adjusted, and it seemed like an extension of last year where we added and we went out to the 15th of April, but it was really just to keep with the 2-month period to allow
Gotcha.
applications to be submitted. And like the previous question said, like it's not a first come first serve program. So if you submit it at 11:59 on the last day, we're going to evaluate that application. It's going to be considered just the same as a February 1. So what I would suggest to all of everybody that's here, don't rush. You don't have to go in February 1st and just throw in a whole bunch of documents that might have errors. Take your time. Get
Yeah,
with your employer, get it filled out, evaluate what your employer is saying you work, because on our side, when we see an attested document, we're going to just validate it based on what you put on online. So
right.
make sure it's correct, because I've had other individuals that said they wanted to claim, no, but I work 45 hours a week. But I'm just like, your attested form says 35. That's what we go off of. So
Right.
there's no rush on February 1st or exactly when the application opens. Like, take your time, make sure if the documents are all good to go and there's not anything missing and everything like that, we're going to push you into the accepted category. And what that means
Right.
is you've met all the eligibility requirements. There's no issue with your documents. We don't need anything further from you. A lot of times, what we've seen in the last few years is a lot of people will submit just, you know, forms that are not complete. They're missing information. All that generates is deficiencies that we email
Yeah.
them and say this is wrong. Take your time.
Right. So yeah,
And
wait till you've got it all. Get it set and send it. Don't send partial information.
Right.
So, and I think that was helpful. Y'all mentioned that earlier. To just sometimes that's an employer issue and just trying to get documentation. So I wish and look what happens. They just keep coming in here. I prompted all these questions. So let's try to
yeah,
get through some of these quickly. So in the
I see
upcoming
that.
cycle, what time frame are you counting hours from? That's a good question. It is fiscal year. Is it January, February? I mean, January through December? What? Clarify that
So
again.
So yeah, we actually backed up this year to April 15th, and it will be through, was it Alan, April 15th through December 1 that we're planning
December
on?
31st.
Yeah,
So
31st.
basically the first
31st
year is
of
going to
net.
get it's going
Yeah.
to get some added time. Moving forward, moving into the 25-26 cycle, it'll go from a January 1st through the 31st of December timeline for volunteerism. With this one, we're just adding bonus time. If you submit hours for volunteerism from now all the way up until the 31st of December. As long as, if you get an award, as long as you have the 25 hours, then you'll be good to go.
Okay, let's stick on hours. I do 40 hours at work at my clinic, but I do additional 20 hours a month in
Yep.
urgent primary care.
So the thing is, like I said, the statute is constraining what's acceptable for frame. So, urgent care and emergency rooms are not going to be eligible to be considered. Um, the primary focus is to try and avoid. It's like the program was developed as an ER deterrent, and so what we're trying to do is get practitioners in there to where they're able to see people more frequently and get
Right.
appointments to avoid having to do like all of us do, where you call the primary care and they're like, oh, we can't get you until next month, go to the urgent care. So for frame, urgent care is like, I've had a couple of questions recently where they're like, I work in an urgent care, and I'm like, yeah, urgent care is not going to fly. Like, you need
Yeah, okay.
a primary care outpatient clinic. So they can just include their hours for their primary care, like outpatient clinic, and roll with that. When we're doing our reviews, if we see stuff for urgent care or ER, we're going to be, denying those anyway.
Yeah, and so I think that's the question that we have at the top there is a limitation on where the clinic is physically, geographically, or is it
So
specific to the type of service that it provides?
So there's a couple of things with HIPSA that a lot of people, aren't aware of. So with HRSA, they're going to give a couple of different designations for HIPSA. If you're in a specialty clinic like a federally qualified health center, FQHC, or Indian Tribal Health Clinic, or a state or federal correctional facility, there might be a facility-based score associated with your facility. Um, if you're not, there are things called, a population or geographic HIPSA. So if you go to the HRSA site and you can look at our portal, and under the HIPSA info tab, it'll kind of guide you through this. And we actually provide videos for how to find your location and everything about your location and the HIPSA that is associated with it. So it really does come down to the location, because I mean, HIPSAs are kind of nuts. They change every year. I had a couple of people that applied the first year because they were in a primary care HIPSA. Within that to the second year, they had rezoned it, and they might have moved to a clinic down the street, but they no longer were designated as a HIPSA. So it's really about going to HRSA's site, taking a look at the address or the facility score to make sure that you're still eligible. And my
Okay.
team is readily available. If you want to reach out to us, we can assist with that. Like I said, we provided videos. HRSA's site's a little bit tricky to kind of navigate, but you can submit requests through the request assistant tab on our portal, and we can help you out with that. If you provide your address, we can look at HRSA's site and then tell you whether or not you're going to be eligible at that site.
Okay, so let's go to this question. If someone gets let's say they have a large loan, they get $150,000 the first year. If after 4 years they still have outstanding loans, could they reapply?
So with
No, yeah, that's a hard stop. So once they hit that,
yeah,
Okay,
it's a
at
really
least, yeah,
interesting question, because it left us scratching our heads a little bit,
yeah,
because within the combination of the limit, let's say it's $500,000, right? 25% of $500,000, you're getting pretty close to a 1 year participant. Once they
yeah,
hit
right,
that max cap for all years, I mean, that's the limitations of the program right now. So
right.
yeah,
Okay,
that's a hard stop. So you can
fair enough, fair enough.
apply.
All right, all
yeah,
right. When applying,
legislature did not put a cap on a single annual award for PC and mental health. They did on dental. They said 50K max, but on PC and mental health, if you come in and you've got that higher limit, you could get $150,000. And then when you look at that, which is interesting, when you divide it into the 25 hours, you do 25 hours of volunteer service, you're getting paid $6,000 an hour. So
Yeah, but that's
I wish I was in a place to get $6,000 an hour and
so
volunteer all the time.
So this one sounds like a good problem. Applying last year, the maximum amount put in for the loan payment was 10,000, but the award was larger. Is this, does that consider for the same year, or does it just go to the 150 cap?
We're starting fresh. It's a new
Yeah.
statute. We're
Okay,
starting
it's
fresh.
starting
The
fresh.
first 2 years are pushed off.
Mhm.
Yeah, it's just easier to navigate with a new statute. So, trying to it almost penalizes participants that have received awards in the previous years because they were capped. I mean, physicians were capped at $20,000 each year. So we didn't find that that was ethical. So moving forward, everybody's starting fresh. Everybody has a 150,000 cap.
Yeah.
Come on and apply.
So there's a question about an FQHC. Does that count as volunteer clinic hours if they work there?
So with
As long as it's, yeah, that there,
Volunteer, right? Not
well, and
employment.
yeah, and that's the problem. One of the things when we've talked with about a number of our FQHC partners, they are very deliberate in the steps that they go through for their volunteers. It's almost there's reciprocity between FQHCs, but to be accepted in an FQHC, which would count, it's probably a little bit longer process to get through with them. Licensure background.
Yeah.
There are steps that they uniquely take among facilities that may impact your timeline.
Yeah.
But
And
just
I
to be
mean,
clear, so if I work for a volunteer clinic, that you can't double dip, so to speak, you would have to volunteer at a
Yeah.
different type of.
we like our stance at Frame is we're not getting into those like the weeds on that. Okay.
Okay.
The
Yeah, we have received official legal guidance that suggests that those IRS and sorry, what is the Fair Labor Standards Act requirements?
Yeah.
Those aren't our domain. We're
Yeah.
not going to
Right.
offer any guidance in there. But reasonably, one would not volunteer with with your employer, unless, of course, it's some special weekend that they're doing. It has to be uncompensated time, and that so it does get a little hairy. But fortunately, our legal office said, "Hey, that's not your problem. Your problem is statute, and that's getting into someone else's domain." So,
we're like you submit your volunteer form, we're gonna evaluate the form.
yeah.
We don't get into the nitty-gritty of, if you're working at FQHC and then you volunteer an additional or a different one, like that's not our domain. We're gonna evaluate, what were primary care services, provided to uninsured or free of charge for the public. And
Okay.
is it a signed, attested thing from the volunteer coordinator? That's
Right.
where we're going.
I got you. All right. I'll come back and answer that one because I need to think about it a little bit more in terms of typing. Is there a minimum amount of primary care patient hours a week to get the award?
No,
No, the more the better, the more that you're more competitive because it's one of those factors that goes into the prioritization formula.
yep.
So, it's a unique balance between hours and location and all those kinds of factors. So, no, there's not a minimum amount.
Yeah.
However, having said that, more hours makes you more competitive.
Yep.
Okay. All right. Do you have to accept Medicaid?
Yes.
That
Yes.
is,
That
one
is
of
by
the things.
statute.
Yeah.
Yeah.
It's by statute, the practice location has to accept Medicaid. And basically, when you're going through the application process, that's why we ask for the payer mix because we're looking at your employer and how much they billed to, validate Medicaid being billed. We go through that in the review process to go into the MPI numbers and we check to make sure that Medicaid is accepted because that is a hard stop. To be eligible, you have to accept
Right.
Medicaid.
How
And
about how about
when we saw the
how,
features of the new bill come out, that was one of the things that was in the bill was all the Medicaid language that they went in and added back in.
So,
So it was a tip of the hat to us.
I mean, you'll notice on the eligibility tab, I actually put pictures that say Medicaid on there just to
okay.
try and tip the hat.
All right. Fair enough. Fair enough. How about an incoming first year resident for next year? So if they're going to be starting residency in the summer of 2025, can they apply several months earlier, still as a medical student?
The thing comes down to licensing. Like
Yeah.
you have to have a clear active license. So we have plenty of residents that are on the TRN or the UO for the obstetrics, but you have to have a clear active license and you have to have active employment during the application window. So if you're starting your residency a couple months after, you probably going to have to wait till the next year.
Okay. All right. Now this long one. Do you see the one by Stephanie Cruz? I
Oh.
can read that.
Let me try and pull it up.
Yeah, pull that one down because
Okay.
it's for physicians.
I'm not
and
seeing any of that. Is it in the chat?
Okay. Yeah,
If you scroll down, you'll
it's
see
a
a
Q&A. For
yeah.
example, physicians are a maximum order of
Yeah, I'm reading it right now.
150K distributed over 4 years. Does that mean every year, of those 4 years, the applicant needs to complete 25 hours of service for each one of those
Yes.
4 years?
Yes.
Yes.
Like basically
Submit a new application each year or just the 25 years? I mean,
it's
25 hours.
Oh, I like that number.
Yeah, wow, man, I just aged everybody. How about
so
that?
the thing is, and I'll be very transparent on this, we had a lot of requests like, can we just recertify and keep our pre-existing applications? The thing is, we can call it a recertification to make people happy, but because the program operates on current employment, like what you're doing right then, it's still going to require the same amount of paperwork. So what we've done, like I said previously, we've reduced the amount of labor and the time consumption for the loan, to where all you have to do is put your existing principal balance for your whole entire loan. So you're still going to fill out the employment verification form each year. You're still going to provide the HIPAA information, but I mean, we still have to verify that you're currently working in an underserved area and you're
And
currently
it's
employed there.
yeah.
So
And it's a different pool each year.
yeah,
No two pools of applications are
I
going to
can
be the
tell you
same.
this. I mean, we had, this is kind of behind the curtain. I mean, we had upwards of almost $260,000 returned to us that went out to other individuals this year because they applied through other programs for loan forgiveness. I mean,
Right.
it's like that happen. The pool does change every year. So that's why I say, like, absolutely reapply. I will say,
Yeah.
like, I can't guarantee you that you're going to get an award. I would never be able to do that. But I don't
Right.
know. I don't know what the award pool looks like moving forward with that $46 million. I don't know. So
Right. Yeah.
I
Right.
highly encourage people to apply.
How about speaking of the volunteer time?
Mhm.
Does that need to be done before you apply? It can be done anytime throughout the year. You
So
just have to you have to submit that before year end.
there's two different ways. I mean, as an applicant puts in their application, we're as reviewers, we're going to look at their volunteer hours that have been confirmed or approved. So an applicant that's already done their 25 hours, they're just going to be able to submit their application and be good to go. So if you don't have your 25 hours at the time of submission, you're going to be required to sign a different attestation. It's a volunteer commitment attestation that will be available to those individuals. And it'll basically say, hey, we're going to take your application, and if it's accepted, you're going to be eligible for an award. With that said, you are going to be required to complete your 25 hours before the 31st of December of that award cycle. So,
Yeah. You still owe it. Basically, it's an IOU, right?
Yeah.
On
Right.
yeah.
voluntary service.
And we don't want to get into that negative side of things. I mean, just to be completely frank, we don't get into like badgering people. It's December, hey, you haven't done your volunteer hours and all the things like that. So I would assume that the individuals that are receiving funds from the frame program will take it upon themselves to make sure that they're taking care of that commitment that they signed. Because we want to avoid that. We want to keep it as a positive program. We're trying to
Right.
help everybody out and go in that route.
Okay. There's no prioritization for residents versus active physicians, practicing
Nope,
physicians, correct? It just
no
depends
different.
on the scoring.
No
Yeah.
difference.
Okay.
We take
Okay.
the clinic hours just the same as an attending physician or whatever. Yeah, there's no
Yeah.
prioritization for residents.
Now this next one, I'm trying to make sure that I'm clear on it. to apply, do you already have to be in an eligible location, or is that established after applying? Imagine
So
that's,
Yeah.
yeah,
So, I mean, this is part of your HIPAA service, right? Your employer, how many hours have
right,
you put in a eligible location? So you could apply on the very last day and have had worked one shift at a qualifying location, and that would be eligible. Now, likely to get scored very low, but you know,
right.
unless you're actually employed in or practicing in a designated HIPAA location, then you know there's
yeah.
it's not going to be an application that will be accepted.
Yeah, I mean, if you're just in the transitional period, I mean, if you're not, you're looking at getting hired on the 31st of March, I would just advise just kind of wait until next year, because that, like, the scoring and the way we do prioritization is based on longevity at the location with the employer, the direct patient care hours provided at the location. Like, we get a lot of questions, especially from like the dental side of the house, talking about, dental graduates, and they're like, can they apply when they haven't yet graduated? It's like, you have to have a license, you have to, check off all the other eligibility requirements. So it might be a year, you might have to wait until the following year. You're eligible if you do 1 hour at a primary care clinic on the 31st of March, you're eligible, but the likelihood of you getting scored, if we were to fully expend and extend past our budget, which, like I said, I don't know, like, this is a new year,
Yeah,
is thing,
right,
but I
yeah.
can't. I've had a
And
couple.
Jay,
All
that's
right,
something
we're
that
gonna,
we haven't talked about that, but might be interesting to folks as well. You know, when we provide an award, the legislature also gave us a mechanism for those folks who have gone and they may have had a different program pay off their debts. We're actually re-rolling that into our overall
Mhm.
budget, so that those dollars that do get returned for whatever reason are actually extending our
Yep.
list. So
yeah, more money for all. All right, we're in the rapid fire round because we only have three minutes left, but we're gonna get through this really quick. I'm gonna try to answer this to clarify the volunteer hours time frame for this year, because the answer was confusing. How many hours through April 2025 count? That's
okay.
the hours aren't required for volunteer until the 2025 application process, correct?
So real easy answer for this year one, April 15, 2024 through December 31st, 2025 is your window to do those hours for the 2025 cycle.
Okay, April through December.
And
Yep.
don't forget, that's crossing over a year.
Yep. Yeah, all
That's
the way
year
to
one.
2025. You get the first year, it gets a bonus. You can submit those hours right now, and
So
they'll
April 2024 through April 2025.
no through December
December
30.
2025.
Oh, all right, there you go.
Mhm.
So you get extra but it only applies for the application cycle that starts in February of 25,
Yeah.
right?
Right.
So
So
you could
now
go,
you've hit on the crossover, right?
yeah,
So
right.
people who do get awards, they may have leftovers that they have to do. And if they don't get those leftovers, they get put on the naughty list. And next Christmas, they're not going to be eligible, right? Not only that, but we're going
Right.
to be knocking on their door. However, for the 2026 cycle, they can start collecting volunteer hours on an annual cycle. So
Gotcha. Okay. Do you look for higher, lower loan amounts to be awarded first,
Nope.
nope,
or should provide? There's no. It says it doesn't matter.
Nope.
It,
Doesn't
nope.
matter.
it's completely agnostic.
If you're
Mhm.
prioritized
Yep.
high
There's
enough
no
to receive an
prioritization.
award,
Yep.
we're gonna pay what the 25% of your principal balance is, and then move on to the next
Right.
person.
They don't
There's
look at it's, yeah, you're blinded to that. Okay.
Yep.
Mhm.
So our prior frame awards counted in the new max amount
Nope.
for
No.
the 150? Okay.
Nope.
We talked about that earlier. And do you need to complete the maximum 24 hours before you submit your application per
Nope.
site? No, we talked about that too. So
Yep.
I think and then there was one that I left out before. I know that you have a rubric for scoring and the priority awards, but that's not public information, correct?
So
The last year's rubric is, and it's on our website. This year's
Yep.
rubric is still going through rules development, so we can't share that
Okay.
yet.
yeah,
The 2025 one will be, okay.
Yeah.
I'll say the core of the prioritization factoring and the formula is still there. There'll be a little bit of a adjustment made by rule once it's processed, but the core factoring and variables are still there. And you can look at the FAQs on our website and it'll show you that formula. So you can kind of get
Okay.
a handle on it.
All right, so it is 6:59. I think we've got all of it answered. And if I haven't typed the answers to them, I'll get them in there because I think we've kind of touched on some of them. And then we got the anonymous thank you. I mean, that's the best question. That's not even a question, but we appreciate the comment and the question and answer thing. And that's what I'm going to do. I'm going to thank our presenters this evening. Jeff Allen, you've been awesome. We really appreciate it because this is an enormous service to our members, primary care physicians, family physicians throughout the state of Florida. And we're gonna, if Alex could post in the Q&A there or the chat, our email addresses, if you have them, we will facilitate getting them to you. Sounds like Alan, you and your team are really out there beating the bushes, getting some answers out to these folks.
I mean, that's what I'm gonna say. They can submit questions through the request assistance tab that you see right there.
Absolutely. Yeah.
And we'll answer them. I check them every morning and make sure that either myself or my team answers those questions.
And Jay, one last thing in closing though is I really, as we're help us help you, and just remember this on the frame of volunteer support. If you know an organization, let us know, and this link takes them right to our website where they can register, so we can make sure that your members have places to go.
That's awesome. Yeah, I'll give you an example. Clay County has the Wave Free Clinic, and I'll make sure that I get that information into you because I know they do great work out here in Clay County, and we'll promote that to our members and make sure that they're getting it out to the clinics that they're participating in, so they get listed for just that. But hey, can't thank you enough. We will be in touch. I'm pretty sure we're going to be in touch.
Awesome.
I'm doing my best Aaron Bean impersonation right now. I guarantee you we will be in touch. So thank you very much. Thank you everyone for participating. I see most of our participants are signing out. They're going to go get some dinner as well as you guys deserve it as well. And we'll be talking to you. Thanks.
All right. Thank you so much, Jay. Appreciate the opportunity.
All right. Take care.
Bye-bye.